So we're here at MST and Associates down in Petersburg, Virginia. I'm with Alex Falkowski, who is one of the partners here. And Alex, you're going to do a walkthrough with us today. So we're starting off with one of my favorite things, hospital beds. So we'll go ahead and get started. And you can kind of give us a little layout here, what's in stock. And people out there can get in contact with you. I'll put all your information down here at the bottom of the video. So first off, we got our VersaCares.
Yep. We have probably around 150 units of VersaCares available right now, air, non-air, some with the zoom features. We also have a large stock of Total Cares, probably somewhere around 50 to 60 in stock right now.
Awesome.
Those are our main inventory right now. It's going to be the VersaCares and Total Cares, as well as advanced beds. But we carry all different kinds of makes and models of hospital beds, from Hillrom to Stryker. We pretty much carry it all.
That's awesome. And, you know, so I know you guys do a lot of international business. For people out there that are looking for beds international, these beds right here, the advanced beds and the Centra beds, which are the spring, older bed models, beds you can get at a really good price, and beds that are still having a lot of life in them. Like these beds were made so well that they'll basically last, you know, another 15 years.
Yeah, absolutely.
And you get couplings, you just get some minor little pieces that are not expensive, and you can basically keep those beds running. And they're, you know, they're affordable, they're easy to ship, and
oh yeah, they're workhorses. They can handle a lot before anything goes wrong on them, and even then, it's something, you know, minor. Exactly,
minor and easy to repair.
Yep.
And here's 3 more rows of just advanced beds, some more VersaCares. And the thing also is, you know, with these international sales, people looking for beds at a low price, you're able to provide the a free used mattress as a packing mattress.
Absolutely.
So when you're getting the bed, you're also getting a mattress, and you can replace the skins. I saw you had some of these Lynette beds in here. Lynette, which I've gotten a little more familiar with in the last year or two, is they're made overseas, made in Czech Republic and over in Germany, depending on, they've got a few different factories over there, but those are also really good beds. And Lynette has seemed to get a good market position with VA hospitals and places around the state. So those are always nice beds to have. It looked like, what, about 15 of them there?
Yeah, and those are starting to become more common. We're starting to see more and more of them come from the various facilities we work with. So.
Right. Now, I know these are sold, but we do need to touch on the fact that you guys do a lot with stretchers.
We do.
You've got a lot of the 1115 primes in here right now.
Yep, those are also becoming more common, so those are going to be more available as the months go on.
Some TransStars, some M Series. Just one other thing, I know this is not a big deal, but a lot of wheelchairs.
Yep.
So for people overseas, you know, if you're looking for hospital beds, you get in contact with Alex over here. You can also get some of the other items. They're really good for a medical clinic, you know, hospital, or those types of things. But having good wheelchairs, you know, is something that you can always use. And, you know, they always come in handy for a lot of international type projects. And obviously the cost of them is very reasonable.
Yeah.
We got some secure twos. What, we got a pain med table over here.
Yep.
What is this?
Let's see.
Oh, is this hydraulic? Yeah.
Yes.
Hydraulic. Is this a Biodex? No.
No. Let's see. It is a Orbi Swiss.
Okay, so this to me looks like an MRI possibly, or something, because this is plastic, and I can tell if they're doing that, they're probably making it set up in a way where it can go to maybe perhaps an MRI. I mean, we can do some research on that. But as we go through here, I know you've got a couple more pain med tables kind of scattered throughout the inventory. More of the advanced beds. And man, when we started in the industry, that was the bed. Man, that was the bed. Loved that bed.
Yeah.
You know, hey, you've got the 2000 model, which is your Air, probably one of the first Air mattresses that that Hillrom put on type of a med-surg platform. So we'll just touch on these. These are psych beds here. These also for overseas would be great if you're going into setting up a hospital or a facility, a clinic, and you don't have electricity.
Exactly.
These would be perfect. Yep. And you could get these right now at a very good price, I'm sure.
Yep.
And we talked about that earlier. I know that there's a couple other places in the warehouse where you have those stocked, but even with the VersaCare beds, Probably one of the best beds Hill-Rom's ever made. Definitely one of the most reliable beds they've ever made. Tons and tons and tons. All your head and foot boards, very well organized, very neat and easy to load and pack. And that's like a very professional way of having it done. So, you know, I know you guys well enough to know that you've been doing this a long time, and you've got that system down very well of getting stuff packed, shipped, and done in a very neat and organized fashion.
Yep, we have our own in-house crew that loads all of our trucks and containers. So, you know, you don't need to hire extra help if you're sending a container or a truck here.
So, I mean, we can just bump down just a little bit down this row, and then we'll go into some of the others. I definitely want to feature the booms and some of the other stuff.
Sure, absolutely.
If you're looking for lab stuff, man, you guys got a lot of lab stuff in here right now.
Lab stuff is becoming more and more common.
Yep.
It used to mainly just be medical surgical, but now I'd say it's probably, you know, 1/3 medical, 1/3 surgical, and 1/3 laboratory.
Lab, yeah. We talked about this earlier, popular item, tabletop blanket warmer. Got some of those in stock. I mean, it's kind of more of the thermo-scientific and some of the other stuff, but I just, you know, in order to kind of give people a visual on some of the stuff that's in here, I just want to kind of peek down there. But, you know, all this stuff, Alex's information will be down at the bottom of the website, so you can contact him direct for anything you see on here. So, Alex, we're going to talk about this later, but MST basically is a company that I want to say is kind of behind the scenes a little bit, because you supply a lot of other companies with their equipment.
We do, yeah.
So, you know, you sell to a lot of the big names in the medical industry here in the States. And then obviously you have a really good international client base where you do sell a lot of stuff overseas as well. But this is a great resource for people to be able to, you know, come in and see or just contact you. The reason we do this, what's in the warehouse video, is because like me, you know, when stuff's coming in by the truckloads, it's hard to keep it inventoried. It sells fast. It goes in and out fast. And sometimes it's like, hey, can I just do a quick walkthrough, which I love to do because, you know, there's things that I might say, oh, that's something I could use or that. But when you can just walk through and get a visual on just some of the stuff that's in there, like even something as simple as these Housestead stretchers, you know, if you're just looking for something that's just low cost, that's reliable, that's going to do the job, these are phenomenal. I mean, I love these things. And down this aisle real quick, we won't go all the way down, but, you know, you've got ENT chairs, you've got all different types of equipment in here. There are exam tables and things, some high-low ultrasound equipment. Over here, we talked about this, lots of infant warmers and multiple different brands. You have the resuscitators, you have the pandas, and it's nice because you have multiple setups. So we've done a lot of clinics overseas, like you have in Africa, and they love these types of setups right here where you can just roll the bassinet up right underneath. And these, you know, for, you know, labor and delivery, I mean, we do, obviously you do a lot of stuff, but we do a lot of stuff with Africa. And so this is, you know, getting the infant mortality rates down and getting good quality medical equipment into facilities where they can take care of these little infants is phenomenal. And this is all equipment that's going to last another 10 years. I mean, this is stuff that's built to last. This is American-made stuff. Okay, high-low beds. And oh, these are some size-wise beds you got here too. Okay, so you got the Carrolls, and then you got some size-wise. Great high-low beds. Oh, these are popular. Yeah. The endoscopy carts. Yeah. So, you know, for people like me that are kind of in the industry, not really in the industry anymore per se, but in the industry still as a person that loves equipment, this is the kind of stuff right here that you get excited when you see stuff like that, especially with all the mounting brackets and that for the TV or for the monitors. So as we come down this aisle here, I can get a better view, but you can see the ENT chairs, a couple podiatry chairs up there. There's another surgical table, all kinds of good stuff. You don't see a lot of these, which are the pediatric stretchers. Tons of pumps. So do you have any projects coming up that you know of, stuff that's coming in, or any? I guess it's summertime. It's, you know, one of those times where administrators are on vacation and, you know.
Yeah, we have actually a couple cleanouts. We actually have guys coming back today. They should be here around noon, right around lunchtime, and they're going to have 2 full truckloads of endoscopy equipment.
Wow.
You know, video towers, scopes galore. There's also a bunch of exam tables coming back as well. So
good.
Going to restock us for exam tables. We're going to have the more popular ones like there's some 104s. 404s, and then I think there is a handful of 623.
Okay.
I believe that's the model 623.
Yep. That's both power head up and down and power table up and down. Yep. So tell me about these booms. And you've got a lot of them. Like there's a lot of cases of these. These are in mint condition.
Yeah, they're in very good condition. They were professionally installed by Stryker, and we assisted them in the removal of it. These things are still fully functional. They still have quite a lot of life in them. And Stryker was just going to pitch them essentially because they didn't want to do anything with it, so we took them off their hands.
That's awesome. Yeah, so people that are out there building a new surgery center, a new hospital, I can see by looking at those, they're not that old. No. And they probably weren't used a lot. And you do see that in our industry a lot, where hospital might have started and got 2 or 3 sets of surgical lights, and then they just said, well, we're going to standardize the whole chain. And make everything the same, and all that stuff you just got last year, it's coming out, and it's going to be the new upgraded model. Or
I'm pretty sure that's what happened with these. The facility got some type of grant.
Yeah,
they got a loan or something, and then decided to change everything to the exact same model.
That's right.
Look identical.
Yep.
So Stryker came in and swapped them out. For
yep. So. And people, because we get that question. It's like, well, how did you get them? How did that happen? It's like, well, you know, when you're in our industry and you see equipment coming out, a lot of times. You scratch your head and go, that's a really good question, because that's really expensive equipment. It wasn't used that long. But for people that are out there that are looking for great deals, you know, Alex and MST gets a lot of good equipment. Like, look at those chromophares you got up there. A nice set of LED lights, man. Those are hard to find right now.
Yeah.
There are not a lot of LEDs coming out. So this is basically, you know, our what's in the warehouse. Alex, you're actually doing our very first segment of what's in the warehouse.
Okay.
So I'm actually really happy right now because, you know, it's just nice. It's like people can sit back, turn on a video and say, okay, let me take a look at what they've got. And, you know, they'll see some of the stuff. There's obviously always a supply of stuff coming in and out, but at least they got your contact information and they can get an idea of kind of what you do. This is definitely another... This is another MRI table. Yep. So that's actually aluminum. And those are hard to find. Yeah. Very hard to find. And this thing is super clean. Oh, yeah. It's super nice.
Clean. The only issue that I found is that it's just missing the other half of this strap right here.
Oh, gotcha.
That's the only issue I was able to find. And the mattress. We don't have the mattress that came.
Yeah, but that's... Yeah, that's...
It's usually because they have to throw it away because of, you know, contamination between patients.
That's right. Like that. Yeah. Yep. And that's a cheap pad, too. That's probably $200. Yeah. We've got an eye stretcher over here. That looks like a Housestead, right? 678 or 578. If it's Steris or Housestead, basically the same thing. So, Alex, as we go through here now, this is warehouse 1. I think we should just let people know that there's... How much square feet do you guys have down here?
Off the top of my head, I'm not entirely sure. I know it's when we tell the square footage to other customers, other clients, they're kind of blown away just by the sheer size of us.
Yeah.
And we also have another building across the street, but that's our disposables and e-cycle operation.
Okay, well, we might go over there next. Yeah. Now, behind this door is where your auction stuff is. Now, there's a lot of furniture and more stretchers and things back there?
Yeah, there's some more stretchers back there. And there's also a lot of medical furniture like waiting room chairs, couches, bedside tables, stuff like that. Yeah. That's what's down there in the auction, getting ready to go live, hopefully by the middle of the month.
That's awesome. So we've done a lot of business together. We've worked a lot in the past, and there were some definite adventures that we had. Yeah. And one of the adventures, now this is an old tobacco warehouse, which is really cool. This place has a lot of history. But I remember going upstairs, and you knew how to use that elevator. That elevator dude was like... That was not your normal elevator. You were able to figure out how to get us up there. Yeah. And that was in the day when you had a bunch of total cares up there. And that's where you had a lot of your disposables.
Yeah.
So we would be running around up there digging through boxes to figure out what disposables were in there, and
trying to put together pallets.
Exactly, which was kind of fun, kind of crazy, but you know, they're all good times. Now coming back here, you know, years later and going through everything, it brings back a lot of memories. So we can go, you do a lot with disposables, a lot of beds, stretchers, the stuff that I would classify that as durable medical, but it's exciting to hear that you're getting a lot of that endoscopy.
Yeah.
I mean, with all the doctors setting up their own private surgery centers right now, to be able to get, you know, good quality endoscopy stuff is always a great asset for.
Yeah. And I would say, in addition to the beds and stretchers being our bread and butter for business, endoscopy is also a very key component of that. It's something that we work very hard on, that we're very knowledgeable on, and that we have a wide customer base to offer the items to. So it's very nice to have the endo stuff coming back in after a little bit of a lull.
Right. Yeah. And that's exactly right, because now we're seeing that, you know, things are really starting to open up. A lot of equipment starting to come out. A lot of equipment starting to come in. There was certainly a lot of issues going on with fulfillment times from manufacturers. I know that some of the big names, Midmark, Ritter, those guys, they were 3, 4, 5 months out on fulfillment of orders. I think they're starting to get caught up now. So now you're seeing a lot of exam tables and things coming out. Yeah. I mean, you basically have a little bit of everything, which is nice. And like you said, there's 2 more truckloads of stuff coming in today. So there is a constant flow of equipment coming in here. Yeah. So, Alex, if somebody's watching the video, they want to get in touch with you, what is your contact number?
You can reach me at 804-704-3423, or you can reach me at my email at alex.falkowski@mstmedical.com.
Awesome. And I will put that down in the description section also. So, Alex, hey, by the way, got it. Okay, because this thing's sitting right in front of me. We didn't go to this section, but you've got these beautiful get-inge warmers with the glass fronts. You've got like 5 or 6 of those.
Yes.
And
they're in excellent condition, fully working. Yep.
Yeah, beautiful condition. A lot of warmers, a lot of cabinets, a lot of other stuff that's out there. So what's in the warehouse? We're wrapping up our first take. Alex, thank you very much for your time. We're going to have this up there, and then we're going to follow up and just do a little quick interview with you to talk about MST and maybe get Mike in there as well.
Okay.
Awesome. Thank you.